In the next panel discussion on building a self-reliant Orissa, innovation in health and education sector, we have invited a panel of experts from health, telemedicine and education sector to shed some light on how they are working towards accomplishing the goal of building a self-reliant Orissa. I would like to invite Mohammed Ujaley, Senior Assistant Editor, ETGovernment, to lead the discussion. Over to you.
Hello and very warm welcome to this special panel discussion focused on building a self-reliant Orissa with innovation in health and education sector. To lead the discussion, today I'm joined by Ms. Yamini Sarangi, Commissioner of Food Safety and Managing Director for Odisha State Medical Corporation, Mr. Reghu Ji, Director Technical Education and Training, and also the CEO of Odisha Skill Development Authority, Mr. Manoj Kumar Pattnaik, Additional Secretary in Electronics and IT Department, also the CEO of Odisha Computer Application Center, Government of Odisha, Professor S.K. Mishra, Advisor Telemedicine Program at Sanjay Gandhi Postgraduate Institute of Medical Science, Lucknow, and also the Distinguished Visiting Professor at Indian Institute of Technology, Kanpur, Mr. Kedarnath Bhagat, Founder and Manager Trustee of Orissa Trust of Technical Education and Training, also known as OTTET. Thank you all of you for joining us for this special panel discussion. Let me begin with Ms. Yamini. Ma'am, let me start with you with the fact that during the pandemic, we noticed that most of the organization face some type of challenges. Would you like to share what were the most significant lessons that your organization learned from the pandemic in terms of healthcare service across the state? Over to you.
Well, to begin with, I will first, obviously, because I was primarily heading the procurement in the state of medical supplies. And so my first lesson, I would focus on my area that I was looking at. So the key lesson we learned was that one needs to adopt aggressive as well as very innovative methods of procurement in cases like what we saw in the pandemic, during the pandemic, which was an unforeseen situation. And as we have been always saying, that it is a once upon a century event, and for which we need to be fearless and aggressive in adopting innovative ways of procurement. So it could include certain innovative ways, like you give incentives to suppliers, which is not a regular methodology in your regular procurement. It could also mean payment through escrow accounts and things and similar procedures. Along with it, what is very essential is that there has to be a robust quality check, even though when we know that at the beginning of the pandemic, there used to be these huge reports of that millions of PPEs are required, vis-a-vis only few are present, etc. So during that kind of rush and the demand, one should not lose focus on the quality aspect of those items that are being procured. So this takes care of the lessons that I would say we learned from the pandemic in a very nutshell. Overall, the various things, various methodologies or ways that we adopted broadly will fall under these areas. Next would be from, and this is not just related to procurement, but also other areas like testing or even surveillance, that there needs to be a robust IT platform to support in case of data capture. So it could mean the data that was captured by during testing, or even if it was not on a real-time basis, at least with the shortest time lag that is possible. It could also mean capturing the right data for oxygen demand so that it can be aggregated properly. It could also mean the entry of the right amount of stock that is available of various supplies. Third would be, I would say, as we all know, and it is a soft skill part, that leadership which emerges in such situations is actually found in some of the most unexpected areas. like we saw that many of these dedicated COVID hospitals or these COVID healthcare centers were actually headed by medical officers who were not having the senior most positions, or they were not really the, let's say, the ADMOs or the CDMOs. They were really somebody whom everybody knows that they can be relied upon, and that's how those they functioned. So these are some of the areas I think that we learned from the pandemic.
Mr. Reghu, as Ms. Yamini was talking about the fact that some of the challenges that different organizations faced during the pandemic and how actually those were mitigated. Would you like to also share what were the most significant lessons learned from the pandemic in terms of the providing education across the state, given the fact that you take care of the skill development? Also, if you could highlight the government's efforts to digitally transfer skill development and technical education system in the state. Mr. Reghu.
Yeah, so again, if I were to start with the lessons again from the pandemic, because that is also a precursor to digital initiatives that we took. At first, it seemed a bit counterintuitive, but the institutions which actually dealt better with the pandemic were not those which adapted digitally first. The institutions which actually dealt best with the pandemic were those who were more alert, more successful in establishing a doorstep contact with the students. So those ITIs and polytechnics, because I deal mostly with ITIs and polytechnics, which had a connect with the students at their doorstep, like they distributed handwritten notes. So those were the institutions which first developed a way of weathering the pandemic. The digital one came later. Second, those institutions which could develop a contact with the parents. Parents were people who were not much in the picture before the pandemic. But then during the pandemic, they realized that talking to the parents also mattered a lot. So the parent-teacher meetings through digitally or physically, those mattered a lot. Life skills mattered a lot. So in our ITS, we have this program with Tata Strive, wherein we teach students, it's not merely life skills, it's also about design thinking, it's also about total quality management, it's also about how to face job interviews, it's also about how you deal with the work environment. So this program which we do with Tata Strive help the students to keep up their morale throughout the pandemic. So life skills turned out to be a kind of a very important aspect of dealing with the students during the pandemic. One more important thing that we learned was that many people think innovations happen in higher level institutions, like maybe the IITs, NITs, higher level science institutions. But a lot of innovation happened at the ITI level, polytechnic level. I mean, these are not really, these may not be big bang innovations, but simple things like making a robot which assists the patients in hospital, things like making face shields. Face shields are not available much during the initial stage of the polytechnic, of the pandemic. Making sanitizers, UV sanitizers, foot operated sanitizers. These are all initially not very much available in the market as well. But these institutions, ITS and polytechnics, could innovate to provide these kind of products. So that is also a bit surprising for us that there can be so much innovation possible at this level. So these are some of the learnings that we carried from the pandemic. So if I were to speak about education as such, as we all know, schools and we fought to open them fast because without hands-on skills, practical training, ITS and polytechnics cannot survive. Others can survive. The managerial education, the other education can survive, but these hands-on skills are so important for the IT and polytechnic students. But then we also had to innovate in technical terms. For that, what we did was that we had a digital content already available. So these are 3D digital contents available at the institute level. What we did was we converted them into an app. It's called the OD Skills app, which is available on Android, and all students can download it and use it at home to study. But then the other problem is internet connectivity. So many of the students could not actually access the app or the contents during the time. So then we had to use WhatsApps or sending notes and all such kinds of things. So that was one of the technical innovations conducted. Exams were conducted in the computer-based testing mode, which was for the first time, I think, in ITS and polytechnics, we conducted exams in the online mode. Even placements were conducted online. So that was a new thing for us. Almost always, employers wanted to have a face-to-face talk with the students. But this time they were also agreed to doing a lot of placements online. A lot of mock tests were done using the Government of India NIMI application. So all these kinds of things help the students to actually cope up with the disconnect that the pandemic caused. But actually the hands-on part suffered a lot during the pandemic, which could not be compensated by any of this.
Mr. Pattnaik, now I'll come to you. As two of our speakers have spoken about the fact that some of the challenges that different organizations were facing during the pandemic, and also how actually those were mitigated. And also Mr. Reghu mentioned about the importance of skill development and how it was actually, it was ensured that there is a continuity of learning even during the pandemic. Since you take care of IT as well as OCAC, you also the director for IIIT Bhubaneswar. Can you share what were the most significant lessons learned from the pandemic in terms of providing education? Also, some of the effort that IIIT Bhubaneswar took to digitally transform technical education in the state. Mr. Pattnaik.
So as far I feel, we have two significant learnings post-COVID. First, online teaching and learning to be an integral part of education system to reach a blended or a hybrid model. This should be universalized. This should be a part of the system. Online teaching should be, or learning should be a part of the system. It should be optional. Second, we must bridge the gap in digital access. Two things, availability of digital equipment and connectivity. So these two things we need to address for education system post-COVID. So these are the two general learnings from COVID pandemic. And about IIIT being a specialized organization, we seamlessly transformed ourselves to digital mode. Document verification during admission was on online mode. We use Google Classroom, Google Meet, Zoom, MS Team for teaching, seminar, presentation on all. Virtual labs through Moodle platform, and evaluation also through Prof platform. So, IIIT has seamless adoption of online teaching and learning. But there are problems also, because the teachers are not somehow, though they are all from IT background, they are not somehow comfortable in the transparency of the examination process, in the online examination process through proctoring model. Also, there is issue of connectivity, and issue of connectivity is a problem across the country. Forget about the rural areas. So online education in the rural areas is a challenge because of the connectivity. Even we are facing connectivity while sitting in Bhubaneswar and Delhi or Mumbai.
I'll come back to you, Mr. Pattnaik, again. I'll go to Mr. S.K. Mishra. Mr. Mishra, you have been working in the space of telemedicine for a long time. And you are also the advisor for telemedicine program as SGPGI Lucknow. And during the pandemic, we witnessed that any organization that had an integrated platform, they were able to mitigate the challenges on the go. And there actually ICT play a very important role. Would you like to share the role of ICT in healthcare and education, which has accelerated manifold over the last 2.5 years? How do you see the acceptance of e-health or telemedicine or even a digital learning within the state? Professor Mishra.
The learning, the health sector involves doctors, nurses, there are many other paramedical workers. So all kinds of professionals are involved in the education process. And like any other educational platform institutions, we have adopted the e-learning modes, and we use the platforms for web conferencing for conducting the online classes, and also do group discussions, etc. should run through this seminar, general club, all these things like any other institutions. We have done that. We remained very busy with the patient care during COVID time. Naturally, many of our clinical classes we could not do it because no admission, hospital is closed completely except barring emergency. It seriously affected the training, definitely of doctors as well as the nurses. Otherwise, we could manage the exams, etc., or admission, etc., through online mode. And exams, particularly in medical sector, you have to follow the Medical Council of India guidelines. And fortunately, The Medical Council of India gave relaxations to do exams through online mode. And external experts are also requested to participate in the secure video conferencing mode. It's a very big challenge, and we have to do it in the last 2 years. But 2 exam sessions, I give exam. So that is very biggest achievement for us, but we have definitely suffered in terms of acquisition of skill. That is only done through practical interventional procedures, and no operation theaters were running. We have seriously affected that. That we cannot replace with any virtual modes that you can do in a non-medical institution. Of course, the portal-based education models are there, so you manage that. Unfortunately, the National Knowledge Network gave some medical colleges a leverage to have a high-speed internet to conduct many of these tele-educational sessions.
Professor Mishra, I will come back to you again. I'll go to Mr. Kedarnath Bhagat. Mr. Bhagat, as Professor Mishra was mentioning about the fact that telemedicine is something which has huge potential to provide, a continuity of medical services or quality medical services, even to the remotest area. And Professor Mishra also spoke about some of the work that has been done over the past year, some of the challenges that we faced. Since your organization works not only in education aspect, but also in the telemedicine in a very broader sense within the state, what were the most significant lessons learned from the pandemic in terms of the healthcare services across the state for you? Mr. Bhagat.
Yes, we are the first telemedicine project started in PP mode with Government of Odisha when there was no taker in the country. Along with the SGPGI MS as a technology partner with the divine grace of Bhagwan Saksai Baba. So the motive was that how we can education for all, healthcare for all, services for all, for moral and spiritual regeneration of mankind. It was initiated in the year 2006. And 2008 we entered into telemedicine. So then people were not readily accepting what telemedicine is. So the pilot project went on up to 2010. Then after 2010 again this pilot system went up to 12. And by that time we reached the goal of telemedicine. But the problem was that the people and doctors both were not comfortable with telemedicine. So a lot of work has been done by OTTET through our entrepreneurs. And ultimately 2012, it was the order was issued by Government of Odisha covering 51,000 villages. And it was going on very well. And after pandemic, it becomes real need of the telemedicine services. So only telemedicine is possible to meet the mismatch of doctor and facility wise and to reduce the direct cost of government and out-of-pocket expenses of people and it can be. So when after pandemic, it has become a real need for the people and real need for the whole country, for the whole world. And by grace of God and with the support of Government of Odisha, especially Honorable Chief Minister Naveen Pattnaik ji, so with their support, it was initiated and it has gone today the only sustainable model of the world. And there is no second. Sustainability has not come. This is the report which has been given by Texas University. They made a global research and their report is already they have given. Then Government of India also. Yes. In between, Government of India also sent their team in 2014. They found that the team had come with Deloitte and other experts. They found it is the only solution which the Government of India is planning to do within a span of 7 years that has already been done. So here the main point is in this particular project, it is totally a grace of Bhagwan Saksai Baba who was guiding at every step for this project, how healthcare can go Because what Bhagavan says that it is not possible. Government alone cannot do everything. So every one of us should join hands with government and to support the government to take up the service projects. So that is how OTTET entered into it. And initial stage, we get the support of Justice Bhagavati, P.N. Bhagavati. He was the advisor of the trust. Then Dr. Kalam, when he was Honorable President, who was visiting Odisha, also he has guided about this project because all of them, they were devotee of Bhagavan Seva. So now, this is a big challenge now, that how to take it forward. We have reached already halfway. We have to go a long way so that the whole world needs it. And government, it is only government who has supported this. And that is just because of the Honorable Chief Minister, it has become possible. And Dr. Mishra also have attended a number of meetings. He was the advisor selected by government of Orissa, was from the beginning, and it has gone to the grassroots level. But unfortunately, the 5T system was not there. So now I am quite hopeful. This 5T and the leadership of Honorable Chief Minister and Odisha will take the lead globally, and it will showcase within a short span. And I am sure within 2.5 years, with full support of the government, we can see that all the 51,000 villages can be covered. Because now people have, after pandemic, people have realized that it is telemedicine only is the access. Because 70% people, those who are living at the rural area, they were not accessible. So now access can be given. So it is well established. And every day we are adding something to take it so that people can get healthcare services at the doorstep. Besides that, also they can have it while they are traveling, where they are out of state. And it is the only system which Government of India is trying to do it now. This is 2017 policy, if you see, that is just what has been done already in Orissa PPP project. That has become the policy of the nation. So 2007 policy, Government of India also repeatedly they have requested Government of Odisha to know about this. I do not know whether it has gone or not, but they are not able to do it. Now one software they are using. So there are so many conflicts on that also. That software cannot give what exactly the need of the telemedicine platform. So anyway, Odisha has taken the lead. Only thing that we can now take it forward and we must plan, and I must request the authorities, mainly Honorable Chief Minister, so to see that it comes in a global field, it should be a model for the mankind, and the people should take it forward. So Odisha it is Lord Jagannath is here, and it is his grace and blessings for which we have such a Chief Minister who is doing whatever best possible for the people of Odisha.
I'll come back to you, Mr. Bhagat, again. And now I'll go to Ms. Yamini. Ma'am, as our speaker have spoken and they have shared their views as to how they look at the pandemic and some of the challenges that they face, and from a healthcare delivery perspective, also from a skill development perspective. And we also noticed over the last 2.5 years that the technology-driven platform came quite handy, and most of the organization which has some sort of integrated platform, they were able to somehow provide or ensure the continuity of learning, continuity of healthcare service delivery, continuity of government service delivery during the pandemic. So I would like to ask you, how do you view technology-enabled platform for enhancing access and quality in healthcare service delivery? Ms. Yamini.
Yes, in fact, just to continue with the previous question, and I totally agree with Mr. Pattnaik when he says that one of the most key practical takeaways has been from the pandemic that major decisions, major meetings, major sessions can be held through online mode. And this is what has been a very, though we may think it is a small achievement, but I would say that at least especially in governance, this has been a great development. Now, coming to your second question regarding technology-enabled platforms for enhancing access and quality in healthcare delivery. So again, to start with the platforms that we have been using at the medical corporation, first of all, for ensuring a seamless supply and inventory management of drugs, medical supplies across the warehouses and then down below to the healthcare institutions, ranging from primary healthcare centers to the medical colleges and hospitals. We have a very robust IT platform called the E&IT, and which is also integrated with the Government of India's DVDMS, which is the Drugs and Vaccine Dashboard Monitoring System portal. And this gives us on a very real-time basis, we know what is the stock position at the warehouses, and this also helps us in making reordering or drugs and items so that they are a certain level is always maintained at the warehouses. So the typical classic complaint that many earlier there used to be there that drugs are not there or the supply has not come, that can be easily first of all checked in the system, and then also if at all there has been some temporary stock out, the replenishment can be done. So this is about the supply chain. Similarly, as far as equipment are concerned, again for the procurement and ranging from the procurement till installation, we follow a very recently we have rolled out a system called E-Upkaran. Then as far as tendering and procurement is concerned, we mostly now procure through the GEM portal, and some of the items which are not available on GEM, we go for this procurement through the e-procurement module of NIC. So these are some of these systems, these technology-enabled platforms, and which is also as per the 5T mandate of the government, where technology is one of the key pillars of this 5T mandate, which obviously leads to transparency and then leads to transformation. So these are certain platforms or certain initiatives or certain modules that we have been using. For file system also, as we all know that Odisha government is widely acclaimed for their secretariat for their online file automation system, where files are tracked completely through the online system. So this is as far as the work is concerned, which ultimately leads to healthcare delivery. The other aspect of this technology platforms, I would say, is the platforms that have been recently rolled out, and they are in various stages of development and implementation, is those for building electronic medical records. So Odisha has rolled out, which Mr. Pattnaik also knows through the IT department, this OEHMIS, Odisha e-health management information system platform. Then we have other IT systems which are used for capturing data through be it the HMIS data used by NHM or and their other related IT solutions ranging from their Unmold tablet, etc. So these are certain things, especially building electronic medical records is quite challenging, but also at the same time is highly essential to as an important step towards healthcare delivery.
Mr. Reghu, now I'll come to you. Would you like to also share, especially on what Ms. Yamini was saying about, the view on technology-enabled platform for enhancing access and quality of education? Mr. Reghu, over to you.
So we were fortunate in the sense that this entire student lifecycle management was already online even before the pandemic started. So the admissions to various ITIs and polytechnics and even to the +2 institutions in the state is managed completely online with the help of OCAC, and the application is called SAMS, Student Admission Management System. So any student after the 10th class who wants to get into an ITI or a polytechnic or a +2 institution, he or she can apply through the central admission management system. It's a very transparent system, and allocations happens based on the merit of the particular student and the category based reservations. So that is the first step in seamless admissions into various education institutions. So even after the student gets admitted into a particular institution, we have the State Council for Technical Education and Vocational Training, the body which actually does the certification part, affiliation part, as well as the conducting the examinations. So this body also has a completely online system wherein the students can get their certificates online, wherein the students can apply for transfer certificates, can apply for transcripts, or can apply for affiliation. Institutions can apply for renewal of affiliations. All these can be done completely online. So under the 5T mandate of the government, all the services of the State Council have been made completely online. And so there is no need for any physical interface for students as well as for government as well as private institutions. So this was done even before the pandemic, but during the pandemic, we made some more services accessible through this particular online platform. That is one thing. Second, like as I mentioned, we had developed the digital contents already, but then during the pandemic, we realized that it should be available on mobile phones. So we created the OD Skills app, where each student can log in with this particular institution ID, with this student ID, and then watch the contents, learn from the contents, as well as take online tests from the contents. But this has again issues of network connectivity and smartphone availability, which is again a major constraint with students who come from a lower financial background of ITIs and polytechnics. But then if we are able to break these two barriers, then the app provides a very good service in increasing the access. So even those students who didn't have smartphones also use the smartphones of their brothers, parents, or even friends to access these contents and study during the pandemic, which is a very beneficial thing for them. Coming to the procurement part, ITIs and polytechnics do a lot of procurement in terms of consumables, in terms of their equipments, welding equipments, all those things. We moved completely to GEMS during the pandemic. So a lot of procurement was done during GEMS. Another important part is consignment of the waste, scrap material that happens in ITIs. So some of the scrap material is recycled in terms of manufacturing new sculptures or equipments, but the scrap that cannot be recycled was sold through the online portal of MSTC. That also helped in streamlining a lot of this vacant space that was lying around in ITIs and made it much more beautiful than it earlier was. So both the GEMS as well as the MSTC portal helped us in this online procurement model. Coming back to the actual courses that we do at ITIs, now there are a lot of new courses available, including the Internet of Things in agriculture, smart city, healthcare. So these courses were introduced, and these are introduced even before the pandemic. But during the pandemic, we realized that these courses have a lot of application. We did drone trainings during the pandemic for the faculty at ITIs so that they could take these courses to students. And these are all new age courses, which have a lot of teaching problems right now in terms of the student adaptability. But it's a new pathway for students, all these courses in the IoT areas. One more thing that was done by the Odisha Skill Development Authority was that we got into an MOU with Coursera, which, as you know, is one of the largest online repositories of knowledge in the world. And the courses were made free to anybody, any student in Odisha who wanted to. And it's not restricted to a 10th standard plus 2 student, but anybody who wanted to reskill, upskill. The courses were made free of cost for the people of Odisha during that particular period. And many of the students made use of this opportunity to take up courses, upskill, reskill themselves. We also had courses happening with Cisco, which was also done online, and ERP courses with SAP, which helped the engineering college students, and many of them managed to land good placements during this particular period of the pandemic. So finally, all these are good for a lot of areas, but there are still many areas left out, especially tribal areas where we have connectivity problems. So we finally went back to Doordarshan actually, and telecast a lot of many programs were made in our government-run Film and Television Institute. So most of these programs are telecast on Doordarshan, not only for our department, but also for the school and mass education. They made extensive use of the Film and Television Institute for conducting their programs and telecasting it to the television at Doordarshan, so that it was much more accessible to a large number of students. So these were some of the initiatives that we took during the pandemic. Thank you.
Mr. Pattnaik, as Mr. Reghu and Ms. Yamini spoken about the fact of having an integrated platform, which could be quite beneficial for any organization. Would you like to also share, based on your experience, as to how did you use a digital platform during the pandemic, and what is your general assessment of enhancing access and quality of education with the help of integrated platform? Mr. Pattnaik.
Mr. Ujaley, Mr. Reghu has given the details of the digital drive in the technical department. To reap the benefit of the digital economy and inclusive growth, dispensing education through digital mode is a must. First, the access gap is to be addressed. Then, use of new technology, maybe inducted in digital content, tracking the performance of the students, supporting the teachers, in all such aspects. So these are actually my findings on the digital intervention going forward.
Now I'll go to Professor S.K. Mishra. Professor Mishra, earlier you spoke about some of the challenges and some of the benefits of telemedicine and e-health services that is currently being run in the country. And we all understand, and it has been proven during the pandemic, that telemedicine is a way forward. But there are huge challenges. Access is a challenge. The connectivity in the remotest area is a challenge. I would like to understand from you, what challenge do you see in implementing telemedicine and digital health at the grassroots level? Professor Mishra.
Thanks for raising a very pertinent issue regarding telemedicine. And telemedicine actually has become very popular. And overnight, the COVID has helped us to make it popular without spending a pie in advertising. But there are issues which have realized before, and the issues are still there. And of course, government is now concerned about that. I'll just raise those as bullet points. Whatever, some very important point is that we have to realize that you have been using telemedicine the way we like. So there is need for a standardization of the telemedicine. Like you must have all realized, and you yourself must have practiced using a WhatsApp. In fact, WhatsApp is the telemedicine for one and all. So that's not so. So there is a serious need for standardization, like standardizing a product. This is a product, this is a device, this is a medical equipment that we need to use solutions. So number two, that we need to standardize the telemedicine practice. Telemedicine practice, there is a guidelines recommended by the Minister of Health, March 25th in 2021. 20 is the red letter for all the telemedicine enthusiasts in our country. We are the first telemedicine practice guidelines launched by the Minister of Health. That has addressed to some issues of concern about legalities, because doctors are very concerned about giving teleconsultations without some kind of protection. But that is not the full proof. We need to work on it. So we are already, our society, telemedicine society is being reporting representation to government to work on this practice guidelines. Nevertheless, it is definitely useful at the moment, but in future, that should be strengthened in terms of the platform-based tele services. We need to also make guidelines for making the institutions are certified to practice telemedicine. The so-called digital infrastructure for e-governance is also required for digital infrastructure for the hospitals. Like ma'am has also said about the electronic medical record, Mr. Pattnaik also said about it. Now, many of the hospitals doesn't have electronic medical records till now. We have now guidelines to develop the Ayushman Bharat, the health and wellness program. So where we have a health record developed at the community center level. We have government solutions coming from the NIC e-hospital as well as the Susrut of CDAC. We have already in the place, and many of these medical colleges in Odisha also are being deploying this thing. So very important to standardize digital infrastructure to practice telemedicine and to secure the consultation process. As you know that in healthcare, we need to have some kind of guidelines for protecting the doctors, healthcare providers. Today, something happens, we have to be careful. And we should all realize what is possible, what is not possible in using telemedicine. Then next is you have raised, many other panelists have raised about the bandwidth, and bandwidth still is not happy. You have seen whether bandwidth for e-learning or bandwidth for telemedicine requires video consultations. We need to have that kind of bandwidth. And most of the bandwidths are mobile internet based, mobile broadband. Today, the definition of broadband is 512 kbps, not 256 of last many years back we talked about it. So we need to have this thing. And we are all enthusiastic about 5G. Let me tell you, 5G will never reach villages. It will never ever reach villages because the companies are more interested for their return. See, now also you go, 4G is never beyond a few kilometers away from the main highways. So if 4G is not reaching, how the 5G will reach? So we have to think of alternate solutions and solutions which are internet based. Today we have the satellite. So new technologies are coming called LEO, low Earth orbit satellites. That is have a lot of hope. Let's see how it happens. So what is important to practice telemedicine is whether for teleeducation or telecare is the bandwidth, the bandwidth, 100 times bandwidth. I'll spell out again and again. Platform doesn't mean anything for now. As you all know, if you can use a mobile phone using WhatsApp to practice telemedicine. So for e-learning, web conferencing, day in and day out, Zoom, Team, all kinds of things are available. Google can also give you free web conferencing system to do it. So that's not a problem. The problem is the bandwidth, and of course the power situation. We need to charge our mobiles. We have faced all those things. We have faced criticism of e-learning. How to counteract that? So what are the alternate solutions of power? That also you need to work it out. So legalities, bandwidth, and practice guidelines, standardizing the infrastructure, standardizing the practice, and making awareness of the doctors. You have just said that even in a triple IT, the IT teachers are not familiar. So you have to make the citizen familiar to adopt it. You have to make the physician familiar to adopt a telemedicine platform. Now, next comes is the in this block or this legislation. Legislation is now, let me tell you, telemedicine practice guidelines is not a law. It is just a emergency situation. We need to develop a law, like in medical council, we have a law for protecting doctors, how to practice medicine. We have several critical medical procedures that we cannot practice with telemedicine. We cannot. You have heard in the literature, telesurgery, telerobotic surgery, teleinterventions. No, that's not possible. Let's not think about that. What is more important is just try to match a face-to-face consultation. Try to gain confidence of our patients, of our citizens, that, okay, this is a solution. You need not have to go. That will really help to cut down the footfall in the hospitals. Our hospitals are very crowded. Now, telemedicine is going to be our future OPD. Now, how to do that? I leave it to all the senior bureaucratic officials present here and to address those issues. I have seen all these things over the years. And let me tell you one thing. There is a segment of population who cannot access it. And what is for them? For a deaf person, for a blind person, for a physical challenged person, how to make them accessible? Here's the equity for that. So please think about that.
Now I'll go to Mr. Bhagat. Mr. Bhagat, how do you view technology platform? As other speaker have spoken about its role on giving access, also improving quality. So how do you view technology-enabled platform for enhancing access and quality in healthcare delivery within the state? And based on your experience, if you could share the challenges that do you see in implementing telemedicine and digital health at grassroots level?
We are very much in the track, and challenges will be there always in every platform. You have to meet the challenge. It is Dr. Mishra himself, none other than him, made the challenge in the year 2008, and suggestion was given. So, as regard to the connectivity, it is a problem. So, wherever connectivity is there, at least people there, they can get. That doesn't mean that connectivity is not there, telemedicine will not go, other things will not. Now we have come to the quantum engineering. Initially there was civil engineering, then mechanical engineering, electrical engineering, then computer engineering. Now it is the world's quantum engineering day is going to be celebrated on 14th of April. So in this age, we have to move. Now people can get Ola, Uber are running. It is the same system which has been developed by OTTET. Anywhere, anytime one can get. It is app. Some actually have collaborated already with us. So far the medical college and hospitals, besides the state, other state people have come, like World Peace University have joined hands to take it forward for the pan-India basis. And other Vishwanath Trust, which has been established by Mr. Venkat Raman, who was the managing trustee of Tata Trust. So they have also done it. So connectivity, wherever is available, we can provide there. It is 70% people, those who are staying in village, they are not accessible. If we are able to give 5%, 10%, 20%, 60%, so it should go continue. It is not that one day it is going to happen. It is in the US also there is a problem of connectivity. It is not in Odisha. That doesn't mean that we will not do the developmental work. And the equipments now through app, as Dr. Mishra rightly said, that it is possible in a mobile phone. Now what has been Ayushman Bharat, the software being used, that is of no use, that is better than that is your mobile phone. You can directly access, because there also you have to use your phone, then you go. Then they cannot. There is already in this connection, some discussion have taken place when the webinar was there in the Government of India, post-budget webinar. They are also working on that. That doesn't mean they will not work. So Ayushman Bharat is also working. Odisha government have gone much ahead, much beyond. So that is the credit. What Government of India have done today, that policy, but that policy has been implemented. Initial stage from 2008 it was planned, and now we have reached to that level that this is the only solution. Grassroots level means every village people should be trained. So they should take the ownership. That is how this can go. It is because not possible in a government system, but government regulative system, it has to be done for that. As Dr. Mishra said that yes, there should be a regulative system, guideline, principle that is already made, and it is always changed. The constitution getting changed, the policy getting changed, so there will be change will come automatically. It is not that we cannot, something we can do, we should stop it. And that Mr. Reghu and Mr. Pattnaik and Madam also have said that how they have gone. Because Odisha is always aggressive. They have met all challenges. And skill, what actually Mr. Reghu was talking about, it is unique. Dr. Pattnaik also, because I have seen. Now my days are over, but I can say only one thing. What Odisha have done so far, very few states must have done that. So we have to proceed, and we must meet the challenge, and we must go ahead, and provided we really implement the 5T principle, we can achieve anything in the world.
This is the last leg of the question, so I'll go to Ms. Yamini. Ms. Yamini, what should be the two prime immediate priorities in terms of innovation in education and skill sector? If you could share your views.
This is not just about the pandemic, but in general, as far as the health scenario, health sector is concerned in the state. Of course, there are many areas where we would need innovative ways to bring solutions, but I would combine them all into two particular areas as requested by you. First is to bridge the gap between detection and treatment. So, which means we are able to detect, we are able to know, but then when it comes to treatment, there is a gap, and this gap has to be bridged. So, which means the gap between the total caseload and the load that we are able to actually reach in terms of treatment, that has to be reduced. And it ranges from all areas, ranging from the NCDs, these non-communicable diseases, the neonatal health, to various areas that are the focus areas of the government, be it malaria or these vector-borne diseases, whichever area. And to do that, one needs to do this gamut of activities, starting from electronic medical records to telemedicine to capturing data at the right point or on real-time basis. So this is number one, first important area about bridging the gap between detection and actual treatment. Second, I would say, though it has improved a lot across the country, across the state, is demand for, because I am from the health department, demand for more and better, robust healthcare from the people themselves. So which means now that free drugs under Biju Swasthya Kalyan Yojana, which is the flagship scheme now, and under which you have funding for E-Niramaya or Nidan, where it is free diagnostics. So when free drugs, free diagnostics, free consultations, and even the treatment in empaneled private hospitals for cases which are not covered in government hospitals, making treatment free for all in the government hospitals, then there are so many facilities. Still, there is certain gap which needs to be closed, though it has improved quite a lot, and for which there must be innovative, aggressive methods of uh, behavioral change communication, or through technology-driven methods to invite people, especially in the far-flung, remote, rural, tribal areas too, so that there is more demand from them for quality healthcare. Thank you.
Now I'll go to Mr. Reghu. Mr. Reghu, would you like to add your views, especially around the two key priorities that government officers should follow right now in terms of skill development and healthcare delivery?
Definitely. So even after the pandemic, the challenges which were there earlier still remain the same, and solutions also are almost in plain sight. It remains the same. Solutions also are there available. So it's almost always said that industrial training institutes as well as the polytechnics run 20 years, 30 years behind of the industries. So industry runs at a fairly quick pace, and the ITIs and polytechnics are always in this catch-up game. So what could be done about that part? So we need to, everybody knows the answer is to increase the industry engagement, but it's not in the normal CSR mode where industries will donate some part of their equipment, or industries will construct a block for the ITI and polytechnics, not that way. So what we need in the new era is industries setting up their own sponsored labs in the ITIs and polytechnics where they can send their untrained workers for training. So this will benefit both the industries as well as the ITIs, because the trainers will get to know the new industry things. In India, a very curious aspect of the industrial training scenario in India is that most of our trainers don't have any industrial experience. It is not the case in other countries like Singapore, South Korea, Germany. In all these countries, if you want to be a trainer, you have to have industrial experience, which is not the case here. So industries will have to help trainers getting industrial experience through attachments, 1 month attachments, 2 month attachments, something of that sort, that they'll also have to do. Industries have to take students on apprenticeship, which is again a very important thing. So the nature of the engagement with industry has to change radically, which I think is happening in Odisha. Many of the major industries here understand all these aspects, and they are also making their efforts to actually empower these technical institutes, because the workers, the employees will come from these institutes finally. So that is one part. Second thing is, how do you add value to the education that a boy or a girl gets in an ITI? So like we have machinist trade, we have fitter trade, electrician trade, we have the normal, traditional trades, all of that we have. But a boy or a girl who comes out after studying in an IT or a polytechnic needs something plus to the certification. So a welder will need advanced certification, let's say non-destructive training. A fitter will need advanced training in welding on stainless steel or aluminum. Similarly, there are every trade. Let's suppose an electrician gets trained in an ITI. He or she will need a electrician license to work in contracts. So let's take the example of a motor mechanic trainer. He or she will need a valid automobile driving license. So these are the additional things that we need to do for a boy or a girl who completes the training in the ITI. So these are the things which we are working at. And to complete my point on this, so we have the World Skills Center in Bhubaneswar, which is again part of the transformation that is happening in the skill development sector. So this is a finishing school for ITIs and polytechnics, one of a kind in the country. Maybe 2 or 3 states more have attempted that, but it's a huge investment that is that we have done, around $183 million investment from the state of Odisha, aided through ADB, in which we are actually trying to give finishing skills to ITI and polytechnic students so that they can have better shot at placements and in really good organizations the world over.
Mr. Pattnaik, your views, especially around the key priorities that we should have right now.
Mr. Ujaley, I will be speaking on behalf of the school education. So our immediate priority is creation of digital infrastructure like digital classrooms, then standardizing the platforms for exchange of the exchange of ideas or exchange of or dispensation of learning. And also we have started working on online examination of the school students, and this will slowly be introduced in all the schools. In fact, government has a school transformation program in which all these things are included. And second thing is this strengthening of connectivity. That is actually very important for us. So we have still villages not covered under mobile connectivity, and internet connectivity is a far cry for them. We are trying with the government of India to cover all the villages under mobile connectivity. Odisha perhaps is one of the few states which has declared the telecom infrastructure as an essential service. So this way we are trying to strengthen our connectivity part. So these are the immediate priorities for us.
Professor Mishra, earlier you spoke about some of the challenges. Would you like to share your views on some of the key priorities that we should have right now, given the fact that we are just trying to get out of pandemic? And if you could share your views.
Thanks for raising this very important issue. This is in fact the talk of the day. So I'll talk a little about Ayushman Bharat and also talk 2 or 3 more things, if you permit me. So coming to the Ayushman Bharat, actually, this is a flagship program of the government of India, and we are very in a fast mode to deploy it. As you know, there are 2 parts of that. We have Ayushman Bharat Jan Arogya Yojana, that's the insurance system, and another is Ayushman Bharat Health and Wellness Program. And another thing is called E-Sanjeevani platform, which has become popularized during the COVID time, right? So Ayushman Bharat Health and Wellness is supposed to cater the CSCs, sub-centers, PSCs down below to contact one of the hub and spoke model, and one of the hub in that particular state. In Odisha, there must be a number of hubs. In Uttar Pradesh, there are 18 hubs, and each hub is connected to 80 to 100 odd, 120 odd sub-centers and PSCs. And they are addressing to the needs of the citizens around that sub-centers. So there is a community health officer, CHO, basically there are nurses, and given 6 months training as National Institute of Health and Family Welfare to cater the basic needs. That define needs, 13 or so deliverables. And the state government is the implementing agency. Say the budget comes to state government under the health mission and it's being implemented. I think we have to do something more than that. Actually, you have raised right questions. Do you think that only the government channel can fulfill? Absolutely, my apprehension is not going to happen. We have to go beyond government, involve the NGOs, trust, PPP partners, and today 60% of the healthcare delivery is given by the private organizations. And big corporate hospitals are launching telemedicine programs. I need not have to name them. They have conversed with the pharmacies and launching the pharmacy along with teleconsultation services. We need to think aloud about that. We have to involve many other people. State government within its own capacity as a health is state subject can formulate guidelines and laws. The point that I want to raise is very important point that because I take the advantage of the 3 senior bureaucrats being here from skill development as well as health as well as from IT. My biggest passion being a teacher to train people. And Mr. Reghu told about the new age skill. Now let me tell you, all our infrastructure that we have to train people with the skills, especially in the lower level or middle level, has never addressed the telemedicine, or now we talk of digital health. We have a number of digital health skills to make a capacity. Just bringing equipments or building a blocks or putting in some corner of the hospital is not going to work out. We set up a school of telemedicine at SGPGI in 2007. And we attempted to train people from Odisha. Unfortunately, could not really proceed further. We want to help. School of Telemedicine at SGPGI Lucknow is going to shake hand with whichever ministry takes over, health, IT, or skill development. We are there to help you out. Our mandate is train people in the village level. There may be a school dropout. There may be a young widow. Or there may be any other unemployed people. We can generate employment for them, training them in digital technology forever. Training them on how to take a diabetes blood sugar test and making a health record of that. There are many small things that can really make impact to prevent non-communicable disease progression. That's one aspect. Second aspect is what I'm talking about, institutionalizing digital health. Today, nobody talks about telemedicine. We talk about today medical records, telemedicine, blockchain technology, artificial intelligence. So many areas are coming up. We need to have institutions. I think Odisha government is very progressive. It has won several accolades internationally, disaster mitigation, now the 5T and all these things. Sitting outside Odisha, hailing from Odisha and left Odisha for about 30 years, I've understood how much Odisha has progressed. There is need to give a big push based on a strategy-based development, and the 5T exactly fit into that. Please consider institutionalizing digital health. Set up an institution for digital health, maybe the first in the country. We have developed School of Telemedicine, but we could not really take that to that far. I'm sure Odisha government can think about that. The third thing I want to talk about is making the entire public aware, making the entire caregivers aware of how important is digital technologies. Ma'am, you told about the electronic medical record. I have my experience being chairman of the computation committee in SGPGI. So much difficulty we had to introduce medical record. It requires a lot of strong determination. I remember the day in 1998, this Susrut was developed in SGPGI. Susrut is we never claimed for any proprietary for that. We donated it to CDAC for the nation. And today Susrut is not being charged. They don't charge any charge for Susrut. They just charge for your deployments. So that is developed in SGPGI. Now we need to train. The director one day said that tomorrow there is no transaction by paper. So that kind of thing has to happen actually. And please forgive me saying that actually. In our deployments, we do not take care of those nitty-gritties. I think you are the bureaucratic process, you know very well. How important is the leadership, determination, and taking along everybody. And let me tell you, being a doctor, medical community is very difficult, very resistant people to change their behavior. So we have to find ways and means to make a bypass of that. And from the IT skill, I request you, sir, I'm there to help you out for School of Telemedicine to join hands to develop skill. We attempted through OTTET, but we failed. It didn't take forward actually. You train them. And today I'm sitting in the IIT Kanpur campus and they're setting up a center of excellence in telemedicine and robotics. And mind you, there are several institutions in the non-medical, non-health ecosystem setting up a hospital. IIC Bangalore setting up a hospital. IIT Kharagpur setting up a hospital. IIT Kanpur is setting up a hospital. So now, and beauty is, they are setting up centers of excellence in telemedicine and robotics. They are setting up center of excellence on several technologies surrounding health. So I think COVID has taught us that we have to strengthen our health infrastructure, strengthen our digital health technology infrastructure, and we have to make people aware how to take advantage. So this is a message for Odisha Transformation 2022. I'm sure, and all of you will take that spirit. And I wish you good luck for all the future of the Odisha.
Thank you, Mr. Mishra. Now I'll go to Mr. Bhagat. Mr. Bhagat, earlier you spoke about some of the challenges and something so good that has happened in telemedicine space in the state. And we also noticed that the central government has launched Ayushman Bharat Digital Mission. What is your assessment of this program when you look at the kind of collaboration that government is making? Are we on right track or do we need to change the gear?
Skill development centers in 14 districts, and already more than 3,000 people have been trained, and health department jointly. And they have been trained, they also appeared the examination under SGPGI, Lucknow Telemedicine Center. They have got the certificate from SGPGI MS, and they are waiting for deployment. Now, madam, what she was talking about, that yes, identified, then next course of action. That is really this platform, what OTTET is doing. That is what exactly is the only solution. Because once it is identified, then you have to connect immediately. And this is only feasible through this telemedicine system. And deployment of the necessary equipment, what all are required. So this is what exactly is the project. So now whatever has been done, past is past, present is before us. And now I am quite sure that with this discussion, we will request our Honorable Chief Minister to provide all support. Then this project should be owned by government. The only problem what I faced, that it was not owned by government. So because there is no cost, OTTET was doing everything. So now it has come to an expansion could not be done properly. So now IIT should look into it and how to achieve the goal that Odisha should become the example for before the world and in service sector. And I am quite sure that with the leadership of Honorable Chief Minister and the in charge of IT Secretary, it will be very much possible. So I will try to put a paper before them and we'll take it forward. We have gone much ahead. We have reached halfway. We have struggled, and now the time has come that we should take it forward. And it is easy after the pandemic, because there is a doctor have understood that yes, they cannot go. People have understood yes, telemedicine, virtually it can be done. Now it has become so easy. So many players are there. All can be integrated in this platform. This platform has been designed in such a manner. Anybody, it will augment the government system without any capital investment of government. This project is taken up, and till date, OTTET have not taken a single penny for 2008 to till date. More than about roughly around 45 crores were spent. We brought the technology from Israel, then SGPGI joined hands, then we converted it to Indian technology, then we designed the equipment also, biochemical equipment. So many things has been done. So since I have done the project in 8 states pilot also, along with Odisha. Gujarat was also one of them. Himachal was another. Bihar, Maharashtra. So all pilot, and my aim was that yes, I must do everything first in Odisha, then only I have to go to other states. So 2014, I was asked by the PMO, and I submitted this report. Then they also contacted the government of Orissa. Then that team has come, as I told before, that yes, they found what they are planning to do, it is already being done. So this is what the state have done so far. So this policy become the national policy today.
With this, we come to the conclusion of this panel discussion. Ms. Yamini Sarangi, Mr. Reghu ji, Mr. Manoj Kumar Pattnaik, Professor S.K. Mishra, Mr. Kedarnath, Bhagat, thank you so much for taking out time and sharing your views on some of the challenges that we faced during the pandemic, especially from the healthcare and education delivery perspective, and how actually technological platform came quite handy during the pandemic. And also your views on central government Digital Bharat initiative and Ayushman Bharat initiative, and as to how that particular program is going to benefit people across the country. So thank you so much for being such a wonderful panelist. Thank you.
Thank you everyone for putting your points on the table and making some very valid statements. Indeed, your initiatives and policies will definitely take the state to the next level of growth. On that note, ladies and gentlemen, we'll take another break. Stay tuned and keep exploring the interesting features of eConfix.